I started at McAuley in late December, orientated with wound rounds for a couple of weeks, and that's actually all I was doing every day, just going, looking at residents, trying to get familiarized with the wound rounds, and I loved it when that's one of the reasons why I moved to this facility. Just the way that it was working and the programs that I could get out of it, very useful. Previously to using wound rounds, I was doing everything paperwork. I would go to the residents' room, do all their measurements, documentation, have to put everything on a paper, come back to my office, do the push tool, do the assessment paper, go to the computer, make my note, and now I can do everything just at bedside. I take my PDA to the patient's room, I get my documentation there, I get my measurements, I just go back to my office, sync it, and it's all there. I love the camera. I remember what the wound looks like when I'm doing documentation, instead of trying to remember how many wounds I saw and which one goes with which resident. I'm actually able to pull it up and just go back and do documentation, a lot more accurate documentation. With the more complex wounds, I use the annotation keyboard at bedside just so I can make myself notes, so when I go back to my office and do a more accurate documentation, I have those little notes to remind me of things that either I need to do, I need to look into, or that needs to be done. The PDA, it's very useful. Everything that we use is included in there, so I can actually go in there and either make recommendations for a treatment change, or I can just jot down what we're actually using at that time. The batch printing is very useful. You're able to set one day to put dates, ranges, put the ranges from one day to another and be able to print all those at once instead of going back to each resident and printing one at a time. It's very useful, a lot less time consuming, and then I'm able to go and sign them all off at once. The formatting of documents that go in the chart for the residence chart, the surveyors, I think, were able to appreciate the formats because they were able to compare the weeks on it, the progress of the wound. They saw the pictures. They saw that the documentation that was right below the picture was accurate with what the picture was showing. The automated wound report is a really good tool. I print it out at the end of the week. I issue a copy to the MDS coordinator, to the assistant director of nurses, to the dietitian, and to our DON, and that way they're able to see the kind of wounds that we have in the building, their stages, their measurements, and the MDS coordinators are able to talk to the families when they're doing their care plans. They're actually able to go back and update the families on how those wounds are doing and what they look like. I like the computerized picture that I'm actually able to prove what the wounds look like. It's so much, it's so different when you're telling somebody or a doctor what it looks like. You're giving them measurements, you're letting them know what the wound bed looks like, but when they actually look at the picture, it all just clicks and hits. They know what it actually looks like. Another advantage of working with wound rounds is you're able to show the families the pictures of what the wounds actually look like without removing the treatments and disturbing the wounds. They're able to appreciate the wounds of what they look like, of what the work that you're doing. And I think they're a lot more thankful and more aware of the resident's condition as they're seeing what you're dealing with.